Hi, we'd like to welcome everyone out to our Targeting Rosacea webinar today. We are so excited to be with you all. I am Tiffany McLaughlin. I am a licensed master esthetician and licensed instructor for 20 plus years, and I am here with my wonderful education team partner and member, Ella Cressman.
Hi, I'm Ella Cressman. I'm also a licensed esthetician and I'm the owner of Ella Cress Skincare and the HHP Collective in Denver. And I am excited to be here with you. Thank you.
So, we are super excited to be with you here today to talk a little bit about rosacea. And Ella, did you know that one of the most searched words of 2020 was rosacea?
That is very interesting. I'm not surprised because I have definitely in the last few years seen an increase in my rosacea clientele. And that especially since we've reopened, just tons. And it prompted me to do some research, and I was surprised to find out just how common it is and how diagnosis is changing and just what that means. They're definitely doing some exciting advancements in the research category.
Oh, most definitely. So, we all know that the cause of rosacea still is unknown. There is not proven clinical studies at this time with a definitive proof of what actually causes
Mhm.
rosacea. But approximately 415 million people in the world do suffer from rosacea. Now, here in the United States, it's about 16 million. So, about 1 in 9 people are affected by rosacea here in the US.
That's crazy, especially when we think about what that means. What does that translate to for our clientele or for our patients? And I know that there are many practitioners who are scared or intimidated with rosacea because it's
Yes.
just such a finicky, it's just a finicky thing. It's a delicate, should we say, condition. But you know what? Even though estheticians can't diagnose or treat rosacea, we can definitely manage symptoms.
Absolutely. So when we look at that, we know that the symptoms between rosacea and inflammation can look very, very similar, even with your hypersensitive or compromised skin. But when we take that approach in the treatment room, some of those things are definitely crossovers by way of what products should I recommend at home, what treatments should I perform, and
Mhm.
one of the things is rosacea is not that scary. It's okay. And so when we have the ability to be confident with ourselves and be confident that yes, I can do this, I can manage and control it, targeting rosacea in the actual treatment room is going to be easy.
Easy breezy.
So when we look at that and we target here in rosacea, today what we're going to be talking about is how to understand rosacea, how to address it. And when we look at that, we definitely want to look at that as a licensed skincare professional and take that clinical perspective approach to our clientele.
Yes, and we know too that rosacea is on the rise, but why? Why are we seeing more rosacea clientele coming in? Is it environmental? Is it systemic, situational, hereditary?
Well, rosacea is a very misunderstood condition. And so when we look at that, because it presents itself so similar to inflammation just visually on the skin, it sometimes can be hard to diagnose. Now, we want to remember that as a licensed skincare professional, we are not a physician. So we can recognize something and we can help manage and control it, but we will not diagnose something for a client. That we
Mhm.
leave up to our physician friends in their doctor offices.
Yes. Another very interesting fact is rosacea in skin of color. For a long time, it was thought that rosacea was a condition that only plagued a certain population. But more and more, we see it in different ethnic backgrounds and even in the higher Fitzpatricks, which wasn't really recognized before. So, very interesting.
So when we look at rosacea, targeting it, manage it, we definitely want to make sure that we help with those side effects and those triggers that are going to initiate that rosacea on the skin. So right now we are going to review our home care programs, our clinical protocols and what is the best targeted approach that we can take so we have our rosacea under control and managed properly. So as Ella kind of talked about, rosacea is definitely on the rise. When we have people starting to come back in and everyone is slowly reopening and hopefully getting back to a little bit more normalcy. What we're looking at today is just the increased research that we have found just specifically on rosacea,
Mm-hmm.
how more and more people are now starting to understand exactly what rosacea is, what it looks like, and therefore there is a much higher diagnosis just on the medical side of things is yes, people do have rosacea and oh my goodness, there's a larger population now being diagnosed with it.
Mm-hmm. You know, one interesting thing that I think was fascinating was a paper published in the Journal of Clinical and Aesthetic Dermatology in July 2020, so not that long ago. And it's
No.
titled, yeah, it's titled Rosacea and Associated Comorbidities, a Google search trend analysis. Fascinating, right? So these two
Technology
doctors,
is always in our lives, no matter if we want it or not.
and it's and now we're using it even more as a tool. So there was two doctors, Dr. Mark Machito and Anna Chen, and they investigated Google search data for a few years, from January 2004 to February 2018. And what they were looking for is search terms of rosacea and other conditions. So what are some cofactors or some comorbidities, hoping to understand what's going on here, what's the cause. So it was fascinating because they were able to then hit a larger population of people.
Right. So, if I'm not mistaken, the analysis included searches occurring in the United States, Canada, United Kingdom, and Australia.
Hmm. Yep.
So they took all of those countries, kind of looked through what was going on. They took that search volume index or SVI data and they plotted it over time with the Pearson correlation coefficients. And then they were calculated from that search data to assess for correlation between those search terms. So if someone searched rosacea, but they also searched high blood pressure, for example, and so they correlated those different types of terms. And then they found those results.
Yes, all looking for how did we get here? What's the root cause? The results were very interesting. So one thing to point out is that the level of interest in rosacea was highest in the spring and
Huh,
lowest in the winter. So interesting, it like maybe environmental then, right? There might be a first clue.
absolutely. Yeah.
That was in the US, Canada, and UK. And the seasonal search trends in Australia were actually opposite. So that's another,
Oh,
okay,
okay.
maybe.
Well,
And
because they're on the other side of the world.
could be. Significant correlations were also found between depression and rosacea search engines in US, dementia and rosacea in the UK, and hypothyroid and rosacea in the UK. They were
Huh.
also found irritable bowel syndrome, ulcerative colitis, and those are all in rosacea in Canada and UK, respectively. In
Interesting.
Australia, search trends were correlated with osteoporosis. So that's interesting too.
Hmm. So some of these conclusions that this large study did was finding that there was definitely a growing interest among just the general public regarding rosacea. So these comorbid diseases, which actually kind of rolls over to clinicians to adopt a more comprehensive approach in managing rosacea patients. So not just looking something overall as a whole and referring back to definitely looking towards the fact that, that client consultation process, that skin analysis, knowing the client's lifestyle is so imperative to
Hmm.
be able to have that successful skincare program.
So not looking at just symptoms, but looking at causes.
Absolutely.
Yeah.
Yes.
So, as Tiffany mentioned earlier, too, rosacea is a very misunderstood skin condition, and it often presents like inflammation. So, it's important to understand what is rosacea. Now, rosacea, there are 4 types and 4 stages. And
Mhm.
with rosacea, it is chronic, thought to be systemic. It never goes away. So, it's important to manage rather than cure.
Yes. Very simple, very similar in that respect to acne, where we know that we can manage and control our acne very, very successfully as estheticians, but we cannot cure it, unfortunately.
Yeah.
So when we look at inflammation on the flip side, inflammation is going to be acute. It's something that comes up and is temporary, but eventually is going to go away unless it's continually triggered. So that's something obviously most of the time is going to happen internally, such as rheumatoid arthritis and things of that nature. But when
Hormones.
we, oh, gotta love the hormones.
Yes. Ugh.
So when we look at inflammation as a whole on our skin, where we are looking at it topically, that the skin is reacting to a perceived threat. So it's something internal. So maybe something that you've ingested. It could possibly be hormones or even something that has touched your skin. If you've seen it, unfortunately, if you've dealt with poison oak or poison ivy, that is a perfect example of you're touching something, you rub up against it, and you immediately become inflamed. So that's where inflammation is going to flip with rosacea.
So rosacea and skin of color. This one is fascinating because previously, as we talked about before, they uh, they weren't thought of to have this condition. It was this very specific Nordic descent,
Yeah.
but so it was underdiagnosed. But now they're starting to recognize, I think, because of looking not just symptomatic, but looking more comprehensively, they are doctors, physicians are creating a diagnosis earlier, which is good because previously the early onset symptoms were not considered.
Yes, yes. And where they have the ability with technology, has advanced and given us the ability to look a little bit more in depth with the skin using that technology with various our LED lights and having the ability to look farther into the skin just visually, we have the ability over time to be able to diagnose rosacea more specifically. Unfortunately, it's when that does happen with skin of color, sometimes it's later in the onset stages of rosacea. So when we do find, oh my goodness, yes, this trigger is rosacea, we are farther along in those stages of rosacea, and the rosacea itself can be a little bit more severe in that regard.
More severe and harder to treat, which is why this the advancements in diagnosis, I think the understanding these clinicians with diagnostic um, authority have is
Yes.
so better. So as we're understanding it more, we, when I say we, I mean the human population, it's great because we're able to recognize and diagnose earlier, especially for skin of color and higher Fitzpatrick's, because if you're catching it earlier, you're able to manage better, and it doesn't
Yes.
advance to those later stages, as Tiffany was mentioning, and then it doesn't become worse.
Right. So being able to look at the stages of rosacea, what do they mean? What do they look like? Now, keeping in mind, visually for us, this is something as a licensed skincare professional that we want to make sure that we have the ability to look at and understand. But once again, being able to diagnose it, we do leave those skin diagnosis to our medical professionals and to our physicians. So when we look at our stage 1 rosacea, that is going to be our pre-rosacea. This is people that blush easily. They're often or experience that facial flushing. So for example, maybe they're taking their morning run and the body heating up, that vasodilation, that's helping. All of a sudden they come back and they're along their cheeks and their nose are very, very flushed. These are the types of people that are very vulnerable to rosacea. And this can begin with a variety of triggers that can once again come back and forth. They can come and go over time. So like I said, they might have it in the morning after their morning run. but then later on in the day, it's completely gone. It can look like a sunburn. It also can be a consequence of, once again, that vasodilation with that blood flowing a lot more. And with those blood vessels being opened up, that increases the blood flow to the face and to the skin. So once again, if this starts to gradually stay longer and longer on the skin, this is where that pre-rosacea stage can gradually graduate into mild rosacea or stage 2 rosacea. And most clients that have pre-rosacea don't even realize it's rosacea. They
It's
think that
inflammation.
it's, yeah, oh, I'm just a little bit red, I'm just hot. It's, oh, it's a hot flash. Really, you're 30? No. But that's one of the things that they want to remember. When we have that mild rosacea, this is when those blood vessels are a lot more sensitive, they're a lot more reactive. They have enlarged to handle that more increased blood flow, and so they continually stay open. So that redness on the skin is constantly there. It's going to last longer. It may leave us or disappear for a little bit, but it immediately, almost immediately comes back. And so this is where the face in and of itself, the skin is going to be more sensitive, and lotions, creams, anything that you're applying topically.
Water.
Yeah, I mean, it's like, ooh, that's kind of stingy. Ooh, that's kind of burny. And a lot of the times, obviously, people, oh, I have sensitive skin, right?
Mhm.
You will start to see those telangiectasias, or those capillaries that have risen to the surface, most of the time on the upper cheeks and nose. But the beauty of that stage 1 rosacea is, with proper home care and our in-clinic treatments, it is very controllable. It's very manageable to help strengthen that barrier in the skin.
And Tiffany, would you say that most of us as skincare practitioners, we're going to be mainly looking at stage 1 and stage 2? Would you say?
Yes, I mean, moderate rosacea, maybe sometimes, but when you're seeing that, most of the time, those are the clients that may have gone to a medical professional to have them look at the situation. The beauty of your stage 1 and stage 2 is it is in that wonderful controllable
Manageable, yeah.
area, manageable area. And so as an esthetician, we can definitely take that mild rosacea, control it. So, we're moving back down into that stage 1.
Like we're sticking something in the spokes of the wheel of rosacea.
There you go.
Now, stage 3, it's getting a little harder. This is moderate rosacea. So at this point of progression of rosacea, it has become persistent and it doesn't disappear for days or weeks like it would in mild. So this means it has worsened and become noticeable and it's permanent, unfortunately.
Yeah.
What's happened is that there's structural damage of the blood vessels in the face, and that's from expanding and contracting. It's like a rubber band, and you pull it, or like a hair tie. You pull it,
Yes.
you get it when it's brand new, it's super tight, and it goes back. But the older it gets, or the more you have put it on, then it's not. It loses its elasticity. So it's different damage, possibly different extents from functional. So the blood is still able to it still have a little bit of contraction, but to
Yeah.
just completely not functioning at all.
It's
Um,
like your favorite pair of leggings that you've worn and you've worn and you've worn, and then you're like, okay, they're just not fitting the way I want them to.
yeah, and they're just more like sweatpants.
Yes, absolutely.
Most severely damaged blood vessels here become chronically inflamed. And so that's when you start to see the redness at the surface, but also the telangiectasia or the cuperos is there too. Um, this is the stage also where pimples, where those little white bumps start to show up, white bumps, red bumps, the beginning of pustules in moderate. In stage 4, in severe, there is an intense flushing, but also swelling, burning, and sometimes pain, accompanied
Yes.
sometimes again with clusters of papules and pustules. The facial skin itself is a deep red. So it's no longer like, I'm so embarrassed. It's the
Yeah.
skin is this deep red, almost purple color. The damage to the blood vessels is severe at this point, and 50% of people who get to stage 4 also develop eye problems, which is we'll go over in the next section. But it's
Right.
usually mild, so it's just something to keep an eye, no pun intended, keep an eye out for because there's a correlation there. Though we can't diagnose, oftentimes we can say, hey, have your doctor check this out for you.
Absolutely.
The other thing that happens in severe rosacea is it's called rhinophyma. It's the bulbous nose. And I don't know if you guys watch Dr. Pimple Popper, but I do. And I've seen it in there. And when I do, and you guys will notice, and this is actually fact, that bulbous nose happens more commonly in men than in women. So
And
interesting.
that's okay by me. I would they can keep that wonderful thing over in your male clientele.
We got
But
their
you
rib. You can have that.
there you go. So when we have our 4 types of rosacea, you can kind of look with all of these different pictures as well, kind of the different stages that you can also see with these different types of rosacea. The first one that you can see is erythematologic rosacea. Say that one 5 times. Whoosh.
Or just say redness. 'Cause I'm not going to attempt it.
With that is that persistent redness on the face. So you can look here at the picture A here over by on the far left hand side of your screen. This is an example of definitely kind of that stage 2 rosacea. You can see where it's not going away, but it's staying. And as you go from B to C, that it's gradually getting to your stage, a defined stage 2, and then that stage 3. Those small blood vessels beneath the skin become enlarged and visible, and those flare ups, they're not necessarily going to disappear for a long period of time. A little bit, but not that long at all. And then once again, that redness is going to become more persistent and more permanent. A lot of the times, you really need to be careful with this type of rosacea because a lot of your skin's vascular growth factors, or VGFs, they're easily triggered, and then that rosacea comes up quickly.
Yes. And the next type is way easier to pronounce. It's Papulopostula Rosacea. And this is when those little baby whitehead pustules start to form, and also surrounded by these red swollen bumps. Typically, you'll see them appear on the cheeks, chin, forehead, and it's often misidentified as acne. The
Yes.
difference between this and acne is a flushing and redness appears as well. Severe papulopustular rosacea can cause over 40 blemishes, and they take a long time to heal. So very interesting. Another place they may, not as common, but they could be potentially is your scalp, neck, or chest.
Yeah, and when it gets into that hairline, it can be just such an uncomfortable situation for your client as well. We also have that Fimatus Rosacea, and this is where the skin begins to gradually thicken and scar. So you have a lot bumpier texture on the skin. It's swollen, it's discolored. You don't see it as often as your other 2 forms of rosacea, but it can be treatable. And you can see here once again with the pictures shown that it will affect the nose a lot more with that rhinophyma. And as Ella had indicated before, it does happen a lot more in men than it does in women. So with that, as estheticians, we almost always see these first 2 stages, this erythematolin tactic rosacea and papulopustular rosacea, a lot more. These are the 2 that are almost always going to be coming into your clinic and saying, hey, what's up with my skin?
Mm-hmm. But something to keep in mind, especially with a lot of lash extensions and people offering
Yes,
many,
yes,
is ocular
absolutely.
rosacea. Ocular rosacea, the eyes start to look bloodshot or watery, and they may have an occasional burning or irritation. Ocular rosacea can cause persistent dry, sensitive eyes, and sometimes cysts may form on the eyelids. So keep an
Oh,
eye
so
out for
painful.
that. Yeah, they're thinking that it's probably more common than previously thought because of the skin and eye connection can be easily overlooked. So I think they're adding that to their more comprehensive diagnostic tools. So that's awesome.
Yeah, absolutely. So when we kind of talk about these different stages, these different forms of rosacea, what is going to trigger that rosacea flare up? Um, my kids always tease me about, oh, I have my trigger words. Um, when they say something specific, it just really gets me going, especially with our dog. But rosacea also has those triggers. So, what are those triggers? There was actually a study done in 2016, and they surveyed over 2,600 patients who were actually diagnosed with various types of rosacea, stages of rosacea, and started to compose a list of some of the common things that would actually induce a rosacea flare up, what causes it to trigger.
Guess what was top of the list?
Dun dun dun.
Not a facial cream. Food and drinks. So, probably a really big connection with digestive health and
Absolutely.
rosacea. But food and drinks at the top of the list. And in that category were alcohol, spicy foods, hot drinks, like in temperature, and then also hot
Yes.
foods in temperature.
So when you're eating that pizza and the cheese is too hot and it burns the roof of your mouth, oh, you hate that. Activities, those are also going to trigger. We kind of talked about with that exercise, doing that morning run or that heavy exertion. So when you're doing that CrossFit or you're on your Peloton, just be aware of how heated your body actually gets. Hot baths or saunas, or even the weather conditions that can cause rosacea. Where I live here in Utah, in the spring, in the first part of the day, we can have amazing, wonderful 65-degree weather. But by 2 o'clock in the afternoon, a storm has rolled in and it is snowing ginormous flakes, and it's between 32 and 35 degrees.
Menopausal weather.
Yeah, it's like, what? And that actually happened yesterday. But with that, keep in mind those different types of weather conditions: hot weather, extreme hot, extreme cold, your humid weather. We don't experience it here, but down south, absolutely. That humidity will almost always initiate some kind of inflammation in the skin. And your crazy windstorms, when the winds blow in, I know in Southern California with those Santa Ana winds, that can aggravate and trigger that flare up, as well as an overabundance of sunlight.
And another thing on the list, higher up on the list too, midway, shall we say,
Yes.
emotions. I mean, it makes sense when we think of blushing. I'm so embarrassed. But also stress and anxiety, which might be the reason why I'm seeing a lot more rosacea clientele since,
Quarantine.
yeah, since opening up because, 2020 was one for the books. 2021 is proving a little better, but it's early.
Yes,
Also, sudden change in emotion, like feeling embarrassed, or even where I like to stay, and that is bursting out laughing. So those quick, it's my favorite thing to do in the world. So those quick changes in emotions, or with Tiffany, one of her trigger words can
yeah,
be
there you
briefly
go.
cause a
It's like,
rosacea trigger.
will you please do your chores? No. What? Trigger. Yeah.
Rosacea.
What is going on? Absolutely. We also have our different medical conditions that can initiate those triggers. Menopause, as Ella was so eloquently saying that sometimes Utah weather can be menopausal. Uh, us women in and of ourselves can be menopausal, where those hormone fluctuations can definitely get us heated up uh, with those hot flashes, and that can once again trigger and initiate a flare up as well. Chronic coughs, so continually coughing, coughing, coughing hard, that's once again going to speed up and increase that blood circulation, and therefore can trigger some things. And also caffeine withdrawal syndromes, where we're maybe trying to be a little bit more healthy and we're trying to drink better, eat better, and with that, when we don't have that caffeine to go away, we have that caffeine removed from our diets, that can also initiate a trigger as well. But there are so many different randoms almost that you're like, well, what? And that is why, once again, I cannot emphasize how important it is to have a proper client consultation before you get into the clinic and perform the treatment, as well as recommending that proper home care program.
Yeah, because you'd think, my face is red, my face feels irritated, so it must be what I'm putting on. And not to say we don't take care when we're applying products or, entering into a protocol with the client, but here's the real, the real truth of this in this study that Tiffany mentioned is at the very bottom of this list of triggers, the very,
Yes,
very bottom, lumped into a category called other factors were skincare products and medication. So this was 8 to 12% of surveyed said that skincare products and medication. So who knows if it's for skincare and
yes.
what the but because they
Prescribed skin, I mean, something that's prescribed.
was
Maybe
it
it was an
prescribed? Was
internal
it
medication.
yeah.
Absolutely.
Yeah. So the key point here is yes, we're careful because it is a delicate condition and we don't want to make it worse, but it's not really that's making it worse. We're
Yes.
helping. What we apply actually helps to calm down. The whoa girl is what I like to call it, like whoa girl of it, because this. So don't be afraid. In other words, don't be afraid.
Absolutely.
The answer isn't just. The answer to the trigger isn't just in what you've applied topically, but the solution can be.
So when we target our rosacea, and we want to do that, like we indicated, both in clinic as well as with a home care program, we must respect the skin. We must respect that it has a barrier, that it's going to bounce back, but it does have a memory. So inflammation and rosacea present themselves very similar in the sense that for the patient or the client and us as the skincare professional, the goal is going to be the same in both circumstances. And often, as we have kind of talked about earlier in the presentation, is that it will and can have a very similar approach. Rosacea is easily triggered, and most of those triggers can be internal, not necessarily something that we've applied topically, with the exception of the external factors like weather. So whether we're starting at a certain point, we always want to have the same desired end effect. We want to have that our skin is controlled and managed, and the redness is virtually, hopefully, non-existent on a continual basis. But we have to have a specific route in order to do that. And so when we do that, first and foremost, we want to make sure that we are targeting those acute skin symptoms first. So acute meaning
Mhm.
immediately. So what do you see on the skin? What pops out at you first? And you're like, whoa, right? That's what
Inflammation, oil,
absolutely,
dry, yeah.
yeah. So that's what we need to definitely target first, get it under control. And then we want to start to manage those chronic ongoing conditions. This can be something like a compromised barrier. Hey, the skin doesn't have the ability to hold its natural hydration. We need to build it back up. We need to strengthen it. We need to make sure that that microbiome in the epidermis is balanced. And if we have a balanced microbiome, we have a strong barrier function, it has healthy function, it keeps the bad out and keeps the good in. That is going to allow us to control that roller coaster syndrome that we can see within rosacea skin, where sometimes it's dry, then it gets over oily, then it's really, really red and irritated. We want to maintain that balance, and that's what's going to be key.
Ooh, imagining the roller coaster. Yeah.
So making sure that we have that balanced sebaceous activity, but we have our wonderful botanicals, our antioxidants. I like to call the superfood for the skin. We have that available, and we are going to make sure that that microbiome is going to be balanced. We If we are applying things topically that are continually thinning the skin and causing just ever so slightly irritation, that is not going to allow us to strengthen that barrier function properly. So we want to make sure as estheticians that we are not recommending products that are too active and over exfoliating the skin, because that can also trigger the skin to flare up.
You know, you just inspired me with something too I wanted to point out here is that there is a way, and we'll talk about it in a little bit, but there is a way to get these exfoliating acids or these stimulus into the skin, and
Yes,
we'll talk about it in a minute. So you can still deliver them, hint.
absolutely.
Yeah. And so that, I guess, a great segue here for how do you take aim at a successful outcome? So if we are targeting rosacea, what do we have? Where do we have to aim our arrow? And the very first and foremost thing that we need to remember is that we should be confident. We're
Yes,
confident because we're educated. So I think that is going to be the key is like, you got this. You can totally handle this. It's something that
absolutely.
is, don't be afraid of it.
No, and that's something that, looking at it, you're okay. They're really red. It's persistent. I'm looking at it, and she came back and says, I feel like I still don't have enough hydration. I'm using XYZ products,
Mhm.
and it's just when I put it on my face, it just makes my face so sensitive. And so making sure we have the ability to identify the stage of rosacea that we are working with is going to allow us to determine, okay, this is the treatment that we should do. This is the specific home care program and products that we need to use. And the beauty of Lyra Clinical is the fact that we have our GPS system, our guide and protect
Mhm.
system, that has been designed specifically to address what the skin needs, not just based on aging, not just based on the skin color, but it takes everything into consideration. So it doesn't matter what gender, what actual age your skin is, or the skin conditions. It takes everything and takes a comprehensive approach to say, this is what the skin needs. And we target the needs instead of the wants, so to speak. So,
Also, what the skin needs right now, because the
yes,
GPS is designed for the reroute, like how I live in a city where there's constantly construction. So even though I know where
yes,
I'm going, sometimes I'll, ask my navigation to get me there faster. And that's really what GPS is in Lyra too. It allows for that freedom to move in the protocol or in the plan, the path, to see what does the skin need right now? How is it changing? And what is my immediate needs? What is my client's
absolutely.
immediate needs? Yeah.
Yes, and creating that in-clinic protocol program gives you that set path. I always say avoid the orange cones. No one likes to see those wonderful orange construction cones when they're trying to get from point A to point B.
Hmm.
So with that, we want to make sure that our in-clinic treatment plan is there. Being able to begin with one of our hybrid treatments that we have available in our treatment guides. We also have our 3D Smart Peel series. All of those things can be considered and put onto the table. And the wonderful thing is all of these classes and all of these Smart Peel treatments and our home care programs are all available in more comprehensive classes directly from your Lyra Clinical educators. So with that, you can contact your local Lyra Clinical representative or distributor outside of the United States for their local class schedules.
Ooh, I also wanted to point out home care solutions. So when we're
Yes,
looking at home care solutions, um, this is the best way to manage and fight rosacea symptoms every day. Something else
yes,
that works really, really well for me and my clientele is that we are in this together. So we have a
absolutely.
monthly check-in. So when we're doing these in-clinic protocols, and then we also have a monthly check-in with the product. So we do more of a toe-in with, I say we because we're in it together, remember? But I
Yes.
toe my rosacea clients in with just a couple at a time, and we redirect to make sure that, like Tiffany mentioned, that roller coaster syndrome, the up and down, to make sure that we're coming to a more normalized, a more homeostatic balance there with the skin too. So we're looking here. What a great segue again. I'm on a roll today.
Who gold star for Ella.
Yeah, speaking of stars, these are our rosacea superstars. So we are going to go over some home care protocols, but here we have our superstar products. These are the uh, no-brainers, the go-tos, if you will, when you're
Yes.
looking at home care. So the
Must
first one,
haves.
my favorite, is the Mystique
Mine too.
Illuminating Cleanser for a lot of reasons. I don't know if you guys have used this as a dermaplane slip, but it's amazing. I love the Illuminating Cleanser because it's amazingly healing, but it's also setting the tone. It calms as it cleans. It's an antioxidant with it has antioxidants like summer snowflake, narcissus extract, and mastica, but not just antioxidant power, they're also brighteners. I love
Yes.
this as a cleanser, like you can apply it dry and remove if you don't want to add water. So at night,
Mhm.
it's an easy cleanser at night, but also for my male clientele, especially my male clientele who suffer from rosacea, this is a great shaving medium for them as
Yes,
well.
yes, absolutely. If they have, sometimes though, when they have that PFB and those ingrown hairs along their beard line, that's your Mystique because of the wonderful properties of that Mastec.
Mhm.
That also helps as well.
Mhm.
So when we look at our next product here is our BB tint. So obviously this is part of our BB cream collection. We have a variety of different color shades that you can choose from, but a lot of the times BB creams are a little bit more preferred for our rosacea clients because it does give you that color coverage.
Mhm.
Our BB tint is our most popular BB cream color. But once again, there are so many different shades that you can mix and match, and you can mix and match with our wonderful BB concealers as well. With the
Yeah.
BB cream, it does have that wound healing property with it too.
Mhm.
It has the Biohydra TRF or tissue reparative factor. So it does help to build up that barrier, and it gives a wonderful breathable SPF 30 broad spectrum protection for the client. So if that client gets that flush, it's still going to allow to release the heat out.
I also love to give the BB Bright to my male clientele. I used to
Yeah,
say I do a lot of men till I realized that was not the best thing to say. But I do have a large male clientele, and the BB Bright, and it's so funny. They're fine with it. Really, they're the most compliant in my
oh
lineup.
yes.
But the
They're
BB Bright is a good one for them, especially for the super inflamed.
Well, there because the BB Bright does have the arbutin and the mulberry, so it has that brightening effect as well. It
Hmm.
it really only has just barely a little bit of color. So once you warm it up to the skin, it just really melts and melds right into just about any skin of color. So
And
that the BB Bright is so universal
I
in that
sell out
regard
of
as
that.
well.
It's so amazing. And I tell them
Definitely
this
a
is the most
popular one.
manly makeup you'll wear, it's great. Another really obviously should be in everyone's for a variety of reasons.
Everyone.
It's like, what should I get? Prolight. Before you even finish your sentence. So Prolight is a powerhouse. Prolight is a little workhorse product, but it's super anti-inflammatory, as everyone knows. It's also a melanin suppressant, but it not just a melanin suppressant, but also melanin repair. It doesn't just calm redness and inflammation, but it also prevents pigment from heat in the skin. So when
Yeah.
we're looking at rosacea and skin of color, this is an imperative product for the lineup. It also has hexylresorcinol, which encourages natural glutathione production, and glutathione is the master antioxidant, the mother antioxidant, I like to say,
Yes.
that we're in our own bodies, that our own bodies make, that fortifies and strengthens other antioxidants around to be more efficient and more effective. So very, very important component that we make endogenously. And this product contains ingredients that stimulate that natural production in ourselves.
#1 international product, hands down,
No,
with
I
Lira.
believe it.
Yes.
I believe
Yeah,
it.
it's just like they order more and more and more, which is okay.
Oh, we should also add that when you're applying this product, you should let it dry completely. So
Yes.
cleanse, apply the
Mhm.
Pro Light, brush your teeth, come back, and then proceed.
There you go. Another very popular retail product is our Mystique Illuminating Beauty Oil. This is actually one of my absolute favorite Lyra clinical products because it is exclusive to Lyra. You cannot find anything more amazing in any other line that way. And it's so universal. Everyone can use it because of
Hmm.
its dry oil application. It gives you that natural skin mimicking hydration. Your skin says, oh, hey, I know what this feels like. I know what this is. And it immediately takes it in and it just absorbs into the skin, concentrated. So a little tiny bit goes a long way, but it does have the wonderful properties of our Mystica, but lipid soluble vitamin C as well. So we have wonderful antioxidant power in that, and our Madonna lily plant stem cells. So once again, always continually addressing that brightening factor as well. The beauty oil works wondrously for both dry as well as oily skin because once again, it's going to
Hmm.
help balance out that roller coaster that our
Yeah.
skin likes to go on. And so it really helps to balance. Another beautiful product and the #1 retail product here in the United States is our Biohydra C Serum. It is a wonderful lightweight serum, 20% vitamin C, but uh, just recently we have reformulated this wondrous product and incorporated topical probiotics and our mass tech. So we have that along with our plant stem cells. And it's just that wondrous combination, lightweight hydration, but really helps to balance and strengthen that immune response topically on the skin. So we have that nice balanced epidermal microbiome that we can incorporate the Hydra C serum with other creams or even the Mystique Illuminating Beauty Oil, or we
You
can use it
know,
by itself.
that's what I like to say in this combination specifically that you mentioned. The Biohydra C Serum with the Mystique Illuminating Beauty Oil is like a Goldilocks combination. So
Yes.
this is exactly where it's too much, it's not enough. This combination is you're able to find that just right.
Yes, absolutely. And 2 to 3 drops of the beauty oil, that's really all you need. I mean,
Hmm.
it's one of just it's so efficient, but very concentrated with its active and healing and restorative benefits.
Mm.
So when we look at our home care solutions,
Let's talk protocol. Let's talk about
absolutely.
a protocol for probably what you're going to see most of, and that is that classic dry, like stage 1, beginning of stage 2,
Yes.
dry classic rosacea. You'll see a lot of these. So what do I do at home? So great rule of thumb, and of course you can venture off of this, but recommending the Mystique Illuminating Cleanser as a twice daily staple in the morning and night,
Mhm.
and then also managing twice daily with Pro Light Serum and the Biohydra C. Not to forget to protect in the morning with the BB cream of choice. As I mentioned, I love to refer the BB Bright is to all of my clientele, both genders. And then in the evening, restoring with the Bio Caviar cream and a few times a week, the Mystique lifting mask. So this lifting mask is amazing for rosacea. Wouldn't you say, Tiffany?
Yes, just with the multiple marine extracts that are combined with mastec, colloidal silver, and gold, It just really calms that skin right down, takes the redness out. And side note, it is actually one of my favorite products to use post extractions because it just
Because of the anti-inflammatory. And you could see it
absolutely.
if you apply to in the treatment room. If you apply to half the face and leave the other half, you wouldn't think that the lifting mask would do this, but it's just before your eyes. It's
Yes,
absolutely amazing.
absolutely. And the
Hmm.
funny thing is, you do that, and then they're like, "What about the other side?"
Nah. See you
I'm
next
like,
week.
"They're leave you unbalanced."
Oh.
And
Oh
then you
yes,
have,
acne, oily acne rosacea.
well, right now, I think I would prefer to do my oily acne rosacea client. No.
I bet you would.
With that, our oily acne rosacea, this is a lot of the times, sometimes those clients are going to say, I just have acne. They only see the acne side of it. They just think that the redness is accompanied with the acne, but usually the redness comes and then the acne follows.
Hmm.
With that, we want to make sure that we are cleansing twice daily with our ice sal cleanser.
Now, Tiffany. Now, Tiffany, you're gonna hear people say, "Wait, rosacea and salicylic,
It's too
what?"
aggressive.
Yeah, but wait, there's more because tell the people about our eye cell cleanser and why it's so amazing, especially for acne, oily rosacea.
So with our ice cell cleanser, you want to remember we have lyrified it. So with
Mm.
that, our entire award-winning ice line does have the advanced healing peptide delivery system with it. So we can deliver that little bit of sal into the skin without that topical irritation or redness. And so when you are working with oily acne rosacea, it's okay to use one or two ice products because it doesn't have that irritation factor. So the ice cell cleanser twice daily helps with that surface oil. It helps with its antimicrobial properties. And that's where you're going to see it to be okay. If it is a tiny bit too active, remember that wet hands, wet face application is going to be a little less aggressive than dry hands, dry face. So once you've cleansed, once again, we're using that Pro Light Serum. It's a must have. Allow it to dry, and then we have our Pro C4 Retinol Serum. So the combination of just that little bit of retinol, that 1% with
And
the
all that
vitamin C,
vitamin C, all those four types, four
plant
forms.
stem cells, that's where we have that little bit of hydration, but it also helps to control with those breakouts. Our BB cream color of choice. And then in the evening, depending upon how oily or how broken out that client is, we can go with our Mystique beauty oil or our ice balancing lotion. So you can see, depending upon how bad the breakouts are, they might use balancing lotion with the sal, and that's okay, or our beauty oil. And ice refining mask, oh my gosh, that flies off the shelves since everyone is experiencing maskne right now.
I
And
have
this
a
is,
confession to make about that too.
oh yeah,
I had a preconceived notion about the ice refining mask. As a Lira practitioner who has been using Lira since inception, since 2010,
yep,
it wasn't until 2020, because you mentioned maskne,
yes,
I really started to fall in love with this. I live in Colorado, and so I treat mostly dry acne.
yeah.
And so it was like, oh, yeah, yeah. But holy cannoli, this is an amazing mask. I just had to pause and just give a shout out to the ice refining mask. But
So yeah, it's super versatile.
hmm.
Use it as a mask. I know depending upon the client, obviously if they don't have rosacea, but if they're struggling with acne and surface oil, a very light application and let it absorb and sleep in it. Or they can spot treat, overnight with just one area on the face. It is just one of those amazing products with, once again, that healing peptide delivery system is what really just makes the product with that combination of that detoxifying charcoal for sure.
Hmm.
So as we graduate from home care solutions into in-clinic solutions, what can I use on my client in clinic? What is going to work the best? And your best solution and your go-to is going to be the VitaBright. Because we have the wonderful antimicrobial properties of Mastec, we have our enzymes, mandelic acid, which has that larger molecular structure. So it drops into the skin a lot slower. So it is a wonderful marriage of a clinical treatment for rosacea because we have the ability to correct without irritating the skin. Your Mystique Elite Signature treatment that everyone, I don't know a person that's like, I don't really like that treatment, because it is for everyone. You can use it anytime, all year round. With our Mystique Elite, if you need a little bit more of hydration, what I like to do is switch out the lifting mask with the chilled biohydrating mineral mask. And that will give the client just a little bit more hydration if they're feeling a little overly dry when you're doing that protocol as well. And you can find that protocol in the Lira Clinical Treatment Manual as well. But as it was released last week, we're super excited. We have targeted rosacea in our brand new seasonal guide Inspire that was released digital last week, called Exhilarate. We're so excited to be able to now be offering, it's not just good for hydrating the skin, but restorative for rosacea.
Yeah, so what's also great about this protocol is it's calming but detoxifying. And
Yes.
after the last 12 months, we could all use a little bit of that, I'm sure. It's perfect for addressing co-issues like inflammation, rosacea, and even pesky maskne.
Yes.
As Tiffany mentioned, the digital version is now available, and we're going to have it here in the attachments attached to this webinar. And then the printed version will be available, including and included in shipments coming soon.
Yeah, probably about a week.
Yeah.
It's almost here. It's almost ready. Sometimes we unfortunately still get a little bit of lag, but
COVID.
yes, COVID.
Blame it on the COVID.
Love the Rona, don't we?
Mm.
Grr. So yes, so we do have a copy that you can download. So you can take a look at our Exhilarate treatment. It has a little bit more of a unique detoxing process where we are applying the refining mask, and then we actually don't remove it. We put the lifting mask over the top, and it is just a wondrous brightening of the skin that you can just see almost immediately. So we're super excited for that. But we would like to thank everyone for joining us today with this
Yes, thank you
our
so much.
our presentation. It's been so much fun to kind of have this co-host situation with my pal Ella.
Yes.
And if you have any questions, you can always contact our corporate customer service with the 800 number at 877-440-5472. And our wonderful customer service staff can help you find your Lyra clinical representative, or you can always go onto the website. Everything is there at lyraclinical.com. So I'm Tiffany McLaughlin saying thank you.
Thank you. I'm Ella Cressman saying it was a pleasure and looking forward to hearing how you're just taking on and targeting rosacea.
Take
Thank
care.
you.